Thanks, Michael, for being here. You're doing incredible work, and to build upon the question from the teacher who is up here saying, how can we get these messages down to younger people? What are people like yourself doing to get the messages up to our policymakers? You know, is this on the mind of Hillary and Obama and the Republican candidates? I'd like for you to speak a little bit about that if you could. How you've mentioned the FDA, you know, how can we influence the FDA? Is that relationship shifting?
Thank you. You know, there is a new politics around these issues that's rising right now, and we saw it around the Farm Bill. We didn't end up with a very good Farm Bill, I hasten to add, despite a lot of work. I spent a lot of time on the Farm Bill. I wrote 4 articles about it last year. I spent a lot of time talking to congressmen, writing letters, and but what did happen was people heard, and in Washington, they really heard. They heard also, for the first time, from the public health community, that the Farm Bill was a public health issue. The commodities, I'm not just talking about the nutrition programs, I'm talking about the commodity programs, which is really the elephant in the room for the whole system. And they heard from doctors, and they heard from public health associations, and they heard from cardiologists, and it really shook them up. And the Farm Bill passed by a much smaller vote than usual. Several very radical amendments got 40 votes in the Senate. So I think we're on the verge of some change. In terms of the presidential candidates, you know, they all have to pass through the crucible of Iowa on their way to the White House. And when you pass through Iowa, you have to bow down before subsidies and ethanol and agribusiness, by and large. And all of them did. That said, there were some very interesting, I talked to people in Iowa when I was there, and they said that both John Edwards and Obama had said some very interesting and radical things. Edwards more so. He called for a moratorium on feedlots. That didn't get reported. That's a pretty radical idea to say in Iowa. And of course, he's out of the race. ADM got to him. He also talked about centralizing all the regulation of food, the safety regulation, under one agency, which is long overdue. I mean, it's totally balkanized system. And Obama, who in his way was a lot more vague about his proposals, did say some very interesting things about agriculture, encouraging local agriculture, organic, but also seems to be making connections between the healthcare piece and the food piece. And that if you're really going to have national health care, the government is going to have to take a much stronger interest in diet, because the government is going to have to pay the price of all this diabetes. One of the things that allows this to go on is that you have the healthcare industry here, and you have the food industry here. And the food industry is producing patients or consumers for the healthcare industry. It's kind of convenient. If the government were picking up those bills, the government would have a very strong interest in putting out a much clearer, simpler, more well-funded message about nutrition than it does right now. So my hope, and with Obama, of course, it's always a leap of faith, my hope is that he will make these connections when he has survived the election.